everyone, this lecture is on iontophoresis, which we have actually talked about and mentioned multiple times before in our E-STEM lectures. Ionto is actually a form of electrical stimulation. And if you're looking for the chapter in your book, it's actually at the very, very end of the E-STEM chapter. So it's just the last couple pages of that chapter. So, in case you didn't know, iontophoresis is using ionized medication and using electrical stimulation to help drive it into the skin. So it's sometimes referred to as a needleless injection. So for people who do not like needles, who have that fear, Ionto is sometimes a good alternative for them. The amount of medication that's actually delivered to the tissue is going to be determined by current density, which if you remember back to E-STEM, current density is talking about using two different sized electrodes and increasing the current density under the smaller electrode. And it's also going to be determined by the duration of treatment, so how long you leave the medicated electrodes on. The major medication types are used with Ionto are anesthetics, analgesics, and anti-inflammatories. And I will tell you, if you ever use Ionto in the clinic, the number one thing you are going to use it for is for inflammation. Dexamethasone is the medication that we use most commonly with iontophoresis, and it is an anti-inflammatory. So Ionto works because there's an ionic reaction between positive and negative poles. So at the positive electrode, positive molecules are going to be driven through the skin, and at the negative electrode, negative molecules are going to be driven through the skin. So this goes all the way back to that very first E-STEM lecture where I told you guys to sort of tuck away and remember Coulomb's law, where opposites attract and like charges repel. So what we do is we use medication that has a known charge. So like I just mentioned, dexamethasone is a very common medication. We call it Dex. We know Dex has a negative charge. So if we put dexamethasone on an electrode and then hook the negative lead up to that, because like charges are going to repel, it will actually drive the medication through the skin. So same thing, we'll talk about different medication types. We do use certain medications because we know they have known charges, and then we just match up the electrodes to them so that we have like charges paired together and they'll repel. The medication is then pushed through the skin. With Ionto, we can deliver medication from 6 to 20 millimeters below the skin, which isn't actually very deep, but then diffusion will sort of take it the rest of the way. So in order to do an Ionto treatment, you need the Ionto generator or the iontophoreser, which is the little machine shown up here. And we do have two machines in the lab that look very much like that one there. You need the medication, the dexamethasone or whatever it is that the patient has been prescribed. In order to get that, the physician will need to prescribe the medication for the patient. The patient will take the prescription to the pharmacy, get it filled, and they will bring in a little vial of liquid medication to physical therapy. You can store it there at therapy, lock it up and just keep it for that patient, but it should just be used for that patient only. And then you will also need custom electrodes. The electrodes that we use for iontophoresis are different than the ones that you used for E-STEM. These are one-time use only electrodes, and we'll be practicing with typically just one size over in the lab. That can be based on the amount of medication that's needed to saturate them. It's going to be marked on every package how much medication each electrode can hold. So I'll show you where to look for those, and like I said, we'll be using the same ones throughout lab, so you'll get pretty used to those. So some of the advantages of iontophoresis. So first one is an advantage over taking like a pill or taking medication. Ionto is going to bypass the liver, right? So instead of taking a pill that has to get processed through your whole digestive system and then spread throughout the body and get to the part that actually hurts, Ionto is driving medication through the skin right on the area that is inflamed or that is hurting. So especially now with like the opioid epidemic, some people can't take pain medication. Some people just don't like to take pain medication. It can do bad things to your stomach and just make you not feel well. And there's other side effects too. So Ionto has the advantage of you don't have to take a systemic medication. The medication is concentrated to a localized area. So again, instead of taking a pill that's digested and spread throughout your whole body, we're keeping the medication right where it needs to be. The next one is comparing Ionto to an injection. So it's less traumatic, less painful than an injected medication, and it's also less concentrated than an injection. So don't get confused here. Bullet number 2 is saying that it's more concentrated. Ionto is more concentrated than taking a pill. Now here it's saying it's less concentrated. It's less concentrated than giving an injection, which could potentially cause irritation or tissue damage at the site. So Ionto is going to be less concentrated than an injection. You're less likely to have some of that irritation or lasting effects. So any disadvantages of iontophoresis? There can be some unreliable results with certain medications. Again, that's why we stick to the few basic medications that we use and use them pretty continuously in the clinic. The amount of medication that's actually delivered to the tissues is somewhat unknown. We typically just judge this by the person's subjective response. Are they demonstrating improvement? Then we're assuming that medication is getting where it needs to be. It is difficult to treat areas of thick skin, so like the plantar aspect of the foot, and it's also, we're not able to treat deep structures like the hip joint itself. So there's some areas of the body that it's just not going to be practical to try to treat with iontophoresis. As far as comparing Ionto to injections, and this is where we usually draw comparisons because, like I said, Ionto is considered to be a needleless injection. Anxiety isn't really any less in children. You come at them with a needle, you come at them with this machine, they don't care. They're typically not going to like either one of them. And so for that reason, we don't do a lot of modalities with kids in general, but we typically don't do Ionto with kids. Injections do become more tolerable over time. People who have to give themselves regular injections get kind of used to it, and they can do it. It's quick, it's easy, it's done, and you won't spend the amount of time that you would need in order to do an Ionto treatment. Also, if you're trying to numb the area, cutaneous anesthesia, numbing the area, to do that by injection is going to give better results. You're going to have more numbness than trying to do it with Ionto. So just keep that in mind too. So the mechanism of iontophoresis, how it works, is that it uses low voltage, high amperage direct current. So direct current, again, way back to that first E-stim lecture, it is that straight line, it's continuous current that stays either all positive or all negative. The typical output is 0 to 5 milliamps. I know that all of our machines max out at 4 milliamps. So 0 to 4 is going to be your typical output. Like with all types of E-stim, your stratum corneum or your outermost layer of skin is going to be our primary barrier. And what happens with Ionto is portals are formed with hair follicles, skin pores. That's the current helps to open them up, and then the medication is able to be driven through the skin. The current applied has to be enough to overcome skin resistance and drive the medication through the skin. And so you'll see Ionto does feel a little bit different than the types of E-stim that you guys have experienced up until this point. And so some people tolerate it really easily, some people don't. And just because you tolerate E-stim well and like E-stim doesn't necessarily mean you're going to like Ionto, and vice versa. So it's kind of hard to tell who's going to really be able to tolerate Ionto up to its maximum output, and who will not. So this is what a typical Ionto treatment setup is going to look like. It is that monopolar treatment setup. So that means there's one active electrode and one dispersive electrode. So again, always 2 electrodes, but the monopolar setup is the one with the medication. The active electrode is the one with the medication. So in this example, this would be the electrode with the medication. It would be a negatively charged medication, and I know that because the negative lead is hooked up to that medication. So again, we're going to match them up, negative to a negative medication. When the electricity starts to run, like charges are going to repel, and that medication is going to be driven down through the skin. This is a dispersive electrode, and then this is the positive lead. And again, both need to be attached to your patient. We need 2 electrodes in order to complete the circuit and run the electricity. I know when you first glance at this, this electrode looks about the same size, if not maybe even a little smaller than this electrode. But I'll show you what one of these active electrodes look like. This whole thing is not an active electrode. There's going to be a smaller patch on the underside of this, and then a lot of this is just sticker to hold it onto the skin. So again, because this active electrode is going to be smaller. It's going to have a higher current density. That's going to help to decrease the skin's resistance, and that's going to allow the medication to be driven through the skin. Ionto will increase blood flow in the local area for about an hour after treatment. The outer layer of skin will stay hydrated for about 30 minutes, and that will allow medication to keep diffusing into the surface, which again may result in a little bit wider than normal diffusion of medication, but again, still more concentrated than taking a pill, less concentrated than giving an injection. It is normal to see hyperemia after a treatment. Hyperemia is just a red discoloration of the skin. It's probably due more to the exposure of direct current to the skin versus much anything else. There is going to be some increased blood flow in the area, and that's going to cause some redness in the area as well. But typically when you do take off iontophoresis electrodes, you will see sort of little pinkish outlines of your electrode on the skin. It's hyperemia, and it is a normal reaction to treatment. So yes, skin irritation can occur. Hyperemia is normal. There is an increased incidence of burn using direct current versus using the other types of current. It's just not as easily tolerated by most people as the other types of stim that we've talked about. They are looking at using combinations of alternating and direct current to deliver certain medications just to make it a little bit more tolerable. But like I said, it's a different sensation than the other types of e-stim. I have personally had it. I think it's done wonderful things for me. It's been very helpful, and I can tolerate it up to 4.0 on every machine that I have tried. So everyone's going to tolerate it a little bit differently. So the commonly used medications, definitely know this list. Any of these medications would be fair game for skills checks and competencies. So dexamethasone, like I said, is the most commonly used medication. It is a negatively charged medication, and it is used primarily to treat inflammation. Dex with lidocaine is also a negatively charged medication. It can be used to treat inflammation with some pain. Lidocaine is going to help treat the pain. Lidocaine with epinephrine is used to treat pain. It is the only positive medication that we may use, and even with that, I have not used it very often clinically. And then the last one is acetic acid. You have all used or had acetic acid at some point, probably didn't know it. That is the technical name for vinegar. It has a negative charge, and it can actually be used for tissue breakdown. And I'm talking about unwanted tissue, like calcium deposits that start to develop in tendons or muscles. We can use acetic acid to start to break them down. And again, that will have a negative charge. So the dosage of medication is measured in milliamps per minute, and it's abbreviated MA/min. Dosage is something that you are going to have to choose when you first set up your machine. Most of the machines are going to use a dose-oriented treatment protocol, meaning you have to set the dosage into the machine, and then the rest of the settings will kind of be figured out for you based on the patient's tolerance of the intensity. So basically, there's 3 settings that will be on the machines that we use for Ionto. The dosage, which you will have to set into the machine. I'll give you some guidelines for how to choose that. Then you'll turn up the intensity. You'll just take that to the patient's tolerance. And then the third one is time. So based on whatever dosage you set into the machine and how high of a current the patient can tolerate, the machine will calculate your treatment time for you. The amperage, or the intensity, needs to be reduced if the patient reports anything other than a tingling sensation. So the maximum dosages, if you're using a negative medication, you cannot exceed 80 milliamp minutes. If you're using a positive medication, you cannot exceed 40 milliamp minutes. Most machines default to 40. You can't go wrong with 40. So I've seen a lot of treatments that are given at 40 milliamp minutes. And there's nothing wrong with that. I'm fine with that. Again, most of the time we're using a negative medication, so that actually gives us some room that we can increase the dosage if the person isn't seeing results. So if you are trying to treat a thicker area of skin or something that's a little bit deeper, you might want to increase a little bit from 40, but you have room to do that when you're using a negative medication. I do have some examples of other types of electrodes that have been developed. This one in the picture here is a low-intensity, long-duration treatment patch where the patient can wear this for up to 24 hours. It has a little self-contained battery in there with a very small charge. So I have a couple different types of these that I can show you when we're in the lab. Hybresis is one, I still talk about it. I don't know if you'll still see it anymore. Empi was the company that sort of came up with hybresis and marketed that a lot. And a lot of places actually used it because what it did was it really cut down on the treatment time that the patient was in the clinic. So hybresis uses special electrodes, and I do have a couple examples of these in the lab that I'll show you as well. And you set them up very similarly to a traditional Ionto treatment. But then what you do is you have this tiny little like battery operated machine on there that you put on. It's warm for 3 minutes, delivers direct current to the tissues for 3 minutes, then it shuts off. You take this little clip off, put it back on the charger, and then the person wears the patch for a given amount of time, depending on how much medication you want them to get. So it can be worn for up to 1 to 2 hours, and I'll show you how you can determine that when we're in the lab. But MP went out of business, and so with that kind of went hybresis. So I do still have it that I can show you. Like I said, I don't know that people are using it anymore, especially with the creation of these types of patches. I know a lot of clinics have sort of switched over and are doing these, as well as some traditional treatments as well. All right, so the medication is dissolved in a carrier, and the rate of delivery is going to be based on the voltage of our machines, the duration or time of our treatment, the local pH, which we don't really have any control over, and the concentration of medication in the delivery electrode. There is a pretty standard concentration dosage, which the pharmacist figures out when they mix up all the medication, and then we put as much on the electrode as it says the electrode will hold. So why do we use these medications over and over again? We use them because we know they have smaller ions. We know that they have a small enough molecular weight that they will actually fit through the skin pores. So we use the direct current to open up the skin pores, and then this medication can actually fit through. So it'll fit through the skin, and it doesn't require such high output intensities in order for that to happen. Medications can be mixed as long as the charges don't cancel each other out, and I'm not talking about you being a mad scientist back in the PT gym. The pharmacist will do all this. So you just learn the list of commonly used medications and what charge they have, and then know how to set up your treatment accordingly. So the biophysical effects of Ionto are going to depend on the type of medication, whether you're using a pain reliever or a numbing agent or an anti-inflammatory, then that's what effects it's going to have on the tissue. It can get down to the levels of tendon and cartilage, which is good, oftentimes, again, what we're trying to treat. One thing to take note of is that the onset of pain relief may take 24 to 48 hours. So when we were doing e-stim before, especially for like pain control and things like that, the person almost had an instantaneous relief of pain. That might not always happen with Ionto. Some people do. Some people walk out of the clinic and they feel a little bit better. Some people, it really does take like a day or two before they start to feel the results. So just to let your patients know that, again, this might not be right away. It might take a little bit of time before they start to feel better. If you are using lidocaine to try to anesthetize the skin, it's going to take a minimum of 10 minutes for that to happen. But again, that's clinically not typically what we're using Ionto for. So this is what at the electrode, this is what they're going to look like. So this would be your active electrode, and this is it flipped over. So this is the side where you'd actually put the medication. So this middle piece is almost like a cloth or something type patch where you'll put the medication right here, and then all this part is sticker. So that's what's going to hold it to the skin. So when you're looking at active versus dispersive, this is the actual active part of the electrode, and then this whole thing is going to be your dispersive electrode. So this is going to go right over the site of pain. This is typically used to treat very local pain. So again, this is where a patient can come in and say it hurts right here, or they can kind of point to exactly where it's hurt. It's not like it's all over this area. Nope, it's this spot right here. So that's where you'll put your active electrode. So just ask the patient, where do you hurt? That's where you put the electrode. The dispersive electrode should be placed 4 to 6 inches away. We're not going to be getting out tape measures to see if you're really 4 to 6 inches away. What I generally say is put it on a nearby muscle belly you are still going to get some of that tingly sensation through the dispersive pad as well. And so that tends to be more easily tolerated if it's on like a little bit of bulk or a little bit of meat. So say if I'm treating the shoulder, I'm going to put the dispersive electrode on the bicep or the tricep. If I'm treating like the elbow for lateral epicondylitis, I'm going to come back up to the bicep or the tricep. If I'm treating something on the foot, I'll probably use the calf. So I'm going to go to a nearby muscle group. And as long as you're a couple inches away, you're fine. Should heat or ice be used before or during treatment? Benefits really haven't been substantiated either other way. The idea is that heat may help to open up some of the skin pathways, but heat also increases blood flow, which is going to wash away some of your medication. So you're going to get your medication spread a little bit larger than your intended treatment area. Ice would help keep it local. I have seen people use some ice with it. Also, for some of the patients who maybe don't tolerate direct current as well, ice kind of dulls that sensation a little bit, but it'll tighten up the skin portal so you might not get as much medication through the skin. My thought is if you're going to use heat or ice, just do it separately if you have time. I know a lot of people do it kind of as a time saver in the clinic, which I get. But if at all possible, try to spread it out and do them as two separate treatments if you can. The other thing is if you put a hot or cold pack directly over the Ionto electrodes, you might get some uneven pressure and some hot spots there too. So I would just use caution if trying to do those together. All right, so that was Ionto, not kind of short and sweet, and we will get to practicing in lab. Thanks.